There are so many different types of ovarian cysts. The most common we see is what's called a follicular or a functional cyst. And the presence of a follicular or a functional cyst is actually evidence that your body is functioning normally. You should make a cyst every month. This is how your body brings an egg up to maturity. It releases with ovulation, and then that cyst will slowly kind of fade away over the next weeks to month. And they're not necessarily problematic. It's normal function. There can be cysts that have bleeding into them. It's called a hemorrhagic cyst. Not typically problematic. They can be uncomfortable, but they're not necessarily dangerous. There can be cysts from something called endometriosis, which is where you have endometrial tissue, the tissue that would line the inside of the uterine cavity. When that tissue is outside of the uterine cavity, you can have cysts on your ovary from that. Those don't typically resolve unless we intervene surgically and medically. There can be things like a dermoid or a teratoma, which is a cyst that consists of three different cell lines at their embryonic stage. And so you can have different contents in that cyst. Those require surgical intervention once they're past a certain size or once you're past a certain age. There's several other types of benign cysts that require either surgical intervention or at least monitoring. And then there's cysts that are more concerning. The more what we call complex or the more involved the cyst is, if it has a lot of different sections to the cyst or if there's a solid component, things like that, are more concerning for potentially like a malignancy. So how the cyst looks on imaging and the patient's symptoms are what kind of guide our management of those cysts. There are multiple ways to treat ovarian cysts. How we treat them really depends on the type of cyst, the cause of that cyst, what a patient's goals are for treatment, the size of the cyst, and any possible complicating factors.